Heart disease has a newly identified trigger hiding in plain sight. But while the science is new, the steps to protect yourself are practical and immediate. For decades, the medical community has focused on an established list of cardiovascular risks: high blood pressure, cholesterol, physical inactivity, and smoking. At the same time, plastic pollution has been framed as an external environmental crisis, affecting oceans and wildlife, but remaining separate from our internal biology. That separation has collapsed. Recent evidence shows that the same synthetic materials polluting the planet are now physically embedded in human arteries. A study published in the New England Journal of Medicine has provided the first direct evidence linking the presence of plastic inside the body to severe medical outcomes. This chart shows the risk levels observed during the study. Patients with detectable microplastics in their arteries faced a 4.53 times higher risk of heart attack, stroke, or death over a 34-month follow-up compared to those without them. This data indicates that microplastics can no longer be viewed as inert contaminants. They are now a factor that physicians must consider when evaluating arterial health. To uncover this link, researchers led by Dr. Raffaele Marfella studied patients with asymptomatic carotid artery disease. They didn't just look at blood samples, they physically analyzed the plaque removed from the patient's arteries during surgery. This chart illustrates the prevalence of specific plastics. In 58% of patients, researchers found polyethylene, used in grocery bags and bottles, lodged inside the plaque. An additional 12% had PVC, commonly used in plumbing pipes and synthetic shoes. Materials engineered for industrial durability and consumer convenience are now a physical part of the debris narrowing our blood vessels. These particles start as larger waste, but heat and environmental degradation break them down into fragments small enough to be ingested through food and water or inhaled from the air. Under a microscope, these aren't smooth or rounded. They have jagged edges that remain sharp as they tumble through the bloodstream. When these fragments settle in the arteries, the immune system responds. White blood cells called macrophages attempt to ingest and digest the particles, but they are unable to break down the synthetic plastic. This failed digestion creates localized inflammation. This chronic irritation can destabilize the surrounding plaque, causing it to crack and trigger the formation of a blood clot. When that clot obstructs blood flow to the heart or brain, the microscopic irritation of a plastic fragment results in a life-threatening medical emergency. For decades, the low cost of plastics made them seem like a harmless miracle of the modern home. But as Dr. Philip Landrigan points out, we are beginning to see the true biological price of that convenience. However, because the risk is tied to biological inflammation, it is a variable you can influence. You have the ability to manage the inflammatory load on your system. The first step is reducing exposure. By minimizing the use of single-use plastic bottles and containers, you lower the baseline volume of particles entering your body. While total avoidance is difficult in the modern world, every reduction in intake decreases the cumulative stress placed on your immune system. The second step is building cardiovascular resilience. Core health habits like exercise and a healthy diet are effective because they lower systemic inflammation, which can help neutralize the irritating effects of any particles already in your system. To recap, microplastics from the environment enter the bloodstream and lodge in arterial plaque, where they trigger the inflammation causing heart attacks and strokes. You can protect yourself by using two strategies simultaneously: reducing your reliance on single-use plastics, and doubling down on foundational heart-healthy habits. By treating microplastics as a newly identifiable risk factor, you gain the clarity needed to take control of your environment and protect your long-term health.